How's your shoveling these days?
Oh, well, it's all done. And I was not dressed like this. so, so Michael, I know one of our dear customers is doing quite a bit of work in e-health, um, without disclosing any of their trade secrets or anything. You've been really involved with it, and I haven't had much more exposure with e-health. So I'd love to get you to explain to us what have you learned, what are the trends out there, and how can we help the folks that are developing and operating e-health application.
Yeah, so I think, Louis, there's a lot going on in e-health. I think the recent pandemic and COVID is accelerating investment into e-health. And if you look at the thing I relate to the most right now with everything that's going on, Louis, and it's an example that I think you and the viewers will resonate with. The biggest challenge in the pandemic is keeping beds open, right? So that you can deal with critical care patients, right? That's the number one challenge. And if you look at hospitals in general, all of their costs and all of their ability to provide services is based on number of available beds. And there are things that go on in hospitals today that are for historic reasons, so that if somebody has a heart condition, they need to be monitored. They will lie in a bed for days being monitored. Now, there's some other techniques where you can attach a little side monitor, send them home, collect some data, come back. But if there's actually concern for the patient, they're being monitored 7/24. Why can't you take that monitoring, make it a mobile monitoring device rather than plugged into a wall, and have the person go home? You just freed up a bed. And you can monitor them 7/24. But to do that, you need a high quality of experience network, which is where we come in, Louis.
That's great. Actually, you know, and I can just imagine a patient, regardless of the age, right? A patient wanting to spend this monitoring time in the comfort of their home rather than, exposed with half a robe in a hospital bed, maybe even in the corridor because they're out of space, right?
Yeah.
So it's beneficial for the outpatient. It frees up room for people that need a lot more than just monitoring. So that's a really good example. And I've heard you talk about, delivering medicine we've heard of trials in Canada and around the world, delivering, cardiac arrest, either monitor or stimulator. You've been involved, or you got any thoughts on these things?
Yeah, so actually, Canada is actually a world leader in drone and drone delivery capability. And there's been pilots run in Canada to deliver defibrillators to crash sites. So one of the challenges in the rural areas is the length of time it takes to get an ambulance to a crash site. And for most of us that live in cities are well aware that many facilities, rinks, libraries have defibrillators on site that the average person can use, and you just call 911 and they'll take you through it, and you can save people. We hear about these stories in our papers periodically, but you get out into rural and there's no library or rink lying around, and they're waiting for an ambulance. Solution: deliver the defibrillator with a drone. The problem is the drone's trying to get from point A to point B, and it loses connectivity to the network. And remember our discussion earlier, what do machines do? I got to go back. I got to go back to find a good signal, and then I got to figure out another path. So the direct path is gone, because you can't have drones flying around not connected to a network. That's an accident waiting to happen. Forgive the pun. So they'll zigzag. That there's a patient that needs a defibrillator at a crash site, and the drone's jumping all over the place trying to get there. That's an issue. That they need to be able to fly line of sight, or as direct path as possible without having issues. So I think for both the outpatient out of the hospital that's having their heart monitored, can't have that disconnected because the hospital's going, we can't talk to Louis. Louis just disappeared. Is he having
Yeah.
a heart attack? Did the device fail? Oh my, we got a problem. Same thing with trying to get a defibrillator. So our evolution of our healthcare system and improving, and I think, Louis, I really liked how you called it outpatient. Most of the e-health is not in the hospital, it's outside. It's allowing us to be treated at a crash site or treated in a reliably.
Yeah, that's, and it's not the Jetsons, right? These things are happening today.
Yes.
They're not as widely distributed in used as they will be a few years from now. But we're seeing that trend, and you just can't fight logic. It's the best way. You know, connected to that and related to that, you can see UPS and FedEx and Purolator are all experimenting with drone delivery from a stationary truck at the end of a highway or something, and then they'll send drones that are just leaving the roof from the roof of the truck, right? So I think the same thing would occur, right? If these drones are to have no communication at one point, they got to go back to a safe place, back to the network, and try a different path, right?
Yeah, and in Canada, by law, they're required to be monitored and piloted, right? Now, it doesn't mean that the pilot has to be physically controlling the drone at all times, but he's got a monitor and he's limited to how many drones he can be monitoring because they're not trusted to be just doing their own thing yet. So it is important that it is very reliable. And where we come in, Louis, is we help them understand that network experience and how to improve it. And we identify issues to them in real time so they can go address it. So they know why. I know why we can't reach Louis right now. We just got a notification that the cell tower went down, or we got a notification that the application that we're running in a cloud has failed. So we know it's not Louis.
So one last question, and I'm itching. I'm sure other people are asking. So if you do have real real time analytics, and the drone is on a certain azimuth going somewhere, we will be able to identify before the drone lose connection. We'll be able to identify it is about to lose connection, and maybe prevent this back and forth to go home and try some different path, right? Very much like a cell phone, 5 bar, 4 bar, 3 bar, 1 bar. You know something's gonna happen, right?
Yeah.
So can our analytics in done in real time, can we actually help the pilot to say, wait a minute, if I go in this azimuth, for sure I'm gonna hit the lack of coverage. Maybe I'll go around, right? Can we actually save them time? Can we react fast enough to help them maybe prevent a lot of these going back home?
Definitely we can help them, Louis, and not for public, but we're engaged with a number of drone companies on just that technology as they look further out in the future what they'll need. So it's an exciting future opportunity for us for sure.